I'm here.
Okay, and I saw that Marianne was here. And it's now, oh, it's 10:52. We got to keep this thing moving if we want to get everything done on time. So welcome back, everyone. So this begins our consultation session. And before our consultation session, I would like to ask if anyone here today has a conflict of interest. And if you do, to declare it now. Just as a reminder, you use the raise hand to be called on if you do have a conflict of interest. And I don't see any hands, so we will begin with the consultation session for the resolutions. So I'd like to remind the consultation representatives of the following. So we have allocated approximately 2 hours for the 12 resolutions, and we'll dedicate a maximum of 6 minutes to each resolution to be able to deal fairly with all of the resolutions. A motion can be introduced and seconded only by a consultation representative. I'll first ask for someone to move the motion and then someone to second the motion. If the motion is moved and seconded, the mover of the motion has 1 minute to speak. A mover can defer that 1 minute to the submitter or an alternate, but we do urge the submitters to be prepared to speak on their own resolutions. If there were any amendments suggested at the session yesterday, please speak to those immediately. Anyone who speaks to a motion on the floor, anyone can speak to a motion on the floor, not only consultation representatives. However, preference will be given first to consultation representatives, then to other RNAO members, and only then to non-RNAO members. Consultation reps are asked to use the raise hand feature to be recognized by the chair, that's me. So to do so, as a reminder, click on the participant box to select the raise hand feature. Speakers are placed in order of raised hands and will be recognized by the chair in that order. When the chair calls on you, you'll be unmuted by the AGM facilitators. So you'll have to state your name and the chapter or region or interest group that you're representing before offering your comments. I also ask that a person only speak once on any given motion unless there's no other raised hands. This way we will ensure that everyone has at least one opportunity to offer their perspective. Once you finish speaking, or if your speaking time's up, you'll be muted again. Use the lower hand feature if you no longer wish to speak and would like to be removed from the speaker list. Raised hands will be lowered by IFRA after every motion. So lastly, I ask you to limit your remarks to no more than 1 minute. IFRA will signal on the screen when you have 30 seconds left to speak, and once again when your time is up, at which time I will ask you to allow someone else to speak. I would now like to invite Marjan Kazrulu, member of the Provincial Resolutions Committee, back to introduce the resolutions.
Thank you, Morgan. Good morning. Before we begin, I would like to briefly explain the resolution process. Members of Provincial Resolution Committee meet as required to receive and prepare in accordance with RNAO's bylaws, resolutions for presentation to the annual meeting. Members of the committee collaborate as necessary with submitters to help them refine and finalize resolutions for presentation to the annual meeting. The members of Provincial Resolution Committee have power to give preference to an affirmative resolution over the negative one on the same subject, eliminate the duplicates on the resolution submitted, determine the order of priority in presenting resolutions to the annual meeting, edit resolutions without the intent of resolution being altered, and reject resolutions which is considered upon legal advice to be in conflict with the law or which it considered to be a matter upon which action has been taken by, is under study by, or is beyond the power of the association. I will now read each of the resolutions and will deal with them one by one. Resolution number 1, recognizing the racism is the social determinants of health and should be included in undergraduate nursing curriculum in Ontario, submitted by Dr. Angela Coupeau-Brave and Dania Varcella on behalf of the Black Nurse Leading Change Interest Group. No known conflict of interest. Therefore, be it resolved that Registered Nurse Association of Ontario, in partnership with others, advocate for racism to be included in the undergraduate and graduate curricula in colleges and universities in Ontario. Therefore, be it further resolved that RNAO collaborate with nursing associations such as Ontario Public Health Association, Canadian Association School of Nursing, Canadian Nurses Organization, and the regulatory body, the College of Nurses of Ontario, and Deans of Nursing and Health Science to implement racism as a course in the undergraduate curricula to educate current and future nurses about the profound harms racism produces on its victims.
So can we have a mover, Dr. Cooper-Brathwaite?
I like to move the amended version.
So we have to do the mover and the help me out, Marianne. Do we have to do the moving and the second and then the amendment?
Yes.
Okay, so we're happy to have you move this and then.
Okay. Angela Cooper-Brathwaite, and I'm representing the Black Nurses Leading Change. I move that this resolution be accepted.
Thank you. Tahicia Tello-Sweetland.
Yeah. Good morning. Tahicia Tello-Sweetland, Halton Chapter. I move to second this resolution.
Thank you. So then we'll go to Dr. Cooper-Brathwaite for discussion. And this is when you could introduce an amendment if you'd like.
Okay, I would like to say racism is a social determinant of health, and determinants of health are defined as non-medical factors that influence the health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems that shape their living conditions. Racism is a social determinant of health because it causes profound harm, physical and mental. Mental, such as depression, anxiety, post-PTSD, as well as underrepresentation in leadership roles in nursing. Researchers in the United States and Canada has shown Black people and Indigenous people and people of color are unrepresented in leadership roles as in academia and healthcare settings. We need to make this change. We need to teach the future generation about racism and its profound harms. I would like to amend the resolution by just adding one or two words to the second therefore.
What is your proposed amendment?
The proposed amendment is, therefore be it further resolved that RNAO continue to collaborate with nursing associations such as Ontario Public Health Association, the Canadian Association of Nursing Schools, the Canadian Nurses Association, not organization, and the regulatory body, the College of Nurses of Ontario, and Deans of Nurses, Deans and of Nursing and okay, you write it, sorry. And Deans of Nursing or Health Sciences to implement racism as a course in undergraduate curriculum to educate current and future nurses about the profound harms racism produces in its victims. Thank you.
Okay, so we need somebody to, Angela's moved that. We need somebody to second the amendment. Diane Millington. Diane, can you unmute yourself?
But I thought I had. Diane Millington, Durham, Northumberland. I so second that motion, that amendment.
Okay, is there any discussion on the amendment? Debbie Kane?
So do you mean this resolution as amended or specifically to the two read amendments?
Specifically to the two read amendments.
Nope.
Okay, So right now, if there's anybody who has discussion on the amendments, raise your hand now. Megan, if there's no discussion on the amendments, then we vote on the amendments and then we discuss the resolution as amended. So there'll be a poll that comes up, again, just for consultation reps to vote about whether you approve, oppose, or abstain to the amendments that were made. It's not approving or opposing the resolution, just specifically the amendments.
Dr. De La Rocha, can you please confirm the results?
Confirming the results.
So we have 96% who approve, 2% who oppose, and 2% that abstain. So the amendment has been carried. So now any discussion on the resolution as amended. Megan?
Hi, Megan Kopsik, Indigenous Nurses and Allies Interest Group. We just wanted to make a comment that with proposing the new curriculum, that you should be working with a Indigenous organization to implement part of this.
Okay.
We can take it, Morgan, we can take it under strong advisement. We would do it for sure. Thank you.
Okay. Ifra, was that the 6 minutes that's up? Or was that individual person time?
No, that was, we have 30 seconds to the 6 minutes closing.
Okay. Debbie Kane, 30 seconds.
Thank you, Debbie Kane, Windsor Essex chapter. And thank you, Angela, for a wonderful resolution. My only concern is that it be a course. Programs may wish to add this as a component in every course rather than having one course that people think is done in 12 weeks.
Can I operationally speak about this, Madam President?
Very briefly, yes.
This is for consultation reps. We take this as advice, and we, of course, will look at what CAS and coupon, etc., and Indigenous organizations want. I think the intent of the resolution is what matters here. And given that time is up, I don't know if someone wants to.
Okay. So the time is up for this resolution. So right now what we're voting on is the resolution as amended. And just, it was a great reminder that Dr. Grinspan gave us that it is, this is advice about what RNAO should focus on and providing direction for what RNAO should be working on. So you should see the poll up to vote.
Dr. De La Rocha, please confirm the results.
Confirming the results.
So that is passed with 93% in favor, 4% opposed, and 3% abstaining. So this is carried.
Congratulations.
Resolution 2, addressing concerns of racism within nursing education and professional practice setting, submitted by Erica Juhas on behalf of nursing students of Ontario. No known conflict of interest. Therefore, be it resolved that Registered Nurse Association of Ontario calls for a province-wide inquiry to review the impacts of racism on understudied groups, such as nursing students and internationally educated nurses. Therefore, be it further resolved that RNAO consider within its materials the inclusion of resources to prevent and resolve resolve racism, bullying between colleagues, and between staff and clients.
Megan, is your hand up for this one? Nope. Sarah.
Hello. Thank you, Ms. President. Sarah Miliajo from the Lakehead chapter, and I move this motion for discussion.
Thank you. Mahogany.
Hi there, Mahogany Hines from the Palliative Care Nursing Interest Group, and I so second.
Okay, so Sarah, were you going to speak to this?
I would love to actually pass my opportunity to the ones who presented this motion.
Is there someone from the Nursing Students of Ontario who would like to speak to this resolution? No. Okay, we'll go to Dr. Paul-Andre Gauthier.
Thank you, Madam President. Remember yesterday we had a discussion about inquiry, and there's no need for inquiry. We're looking for action, and I think that's time for action. There's so many inquiries that take 5 to 10 years. We don't need that. So I will move to split the two resolution, because if not, we will lose it. So split the two, therefore ours.
So can you specify what it is that you want to see different in this? I understand the piece about the inquiry, but can you give us the specific language you're looking for, please?
Well, I'm just splitting them. So there will be one, the first therefore, and the second one be at resolve.
So I don't think that you can split it into two separate resolutions.
We can't. We have done that in the past.
Madam Chair, if there is no one from the submitters that opposes it,
okay.
what Dr. Gutierrez is asking is simply to vote first on the one therefore and second on the second.
Okay. So you are moving to separate it into one, therefore be it resolved, and a second, instead of further resolved, therefore be it resolved, two separate votes. Paula Manuel, do you have your hand up to second that? Paula, you can unmute yourself if you want.
No, I was going to speak to the resolution itself.
Okay, so we need somebody to second the motion before, because that's the point that we're at. That Lacey, is your hand up for that?
No, I wanted to discuss it as well.
So can everybody put their hands down unless they want to second the splitting it into two separate pieces? Victoria?
Victoria Murray with the Halton chapter, and I second it.
Thank you. Okay. So any discussion on splitting it into two separate pieces?
No. No.
Okay, so nobody has their hands up to discuss it. So now there'll be a poll that comes up, and what we're voting on is separating it into the amendment of two separate resolutions.
Yes.
Okay.
Dr. De La Rocha, can you please confirm the result?
Confirming the results, Ifra.
So that's passed. We have 74% approve, 10% oppose, and 16% abstain. So now we'll open it for discussion on the first, so therefore be it resolved, what you see on your screen right now. So Janet.
Hi, Janet Hunt, Middlesex Elgin. Just in the rewriting there, IFRA may have crossed out province-wide inquiry, but I think that needs to remain in if it's a separated motion.
Paul Andre is the one who moved it. Can you confirm whether you wanted to move it with the province-wide inquiry out?
No, I didn't.
Okay.
That's part of the discussion now that is split. Thank you.
Okay, thank you.
Paul Andre.
So any, Lacey?
Hi, Lacey Van Every from Brett Haldeman Norfolk chapter. Just a question of clarity. I would like to know if this is able to be discussed with the submitters not being present.
Yes, so we can discuss it without them being present. It makes it more difficult because they're not able to tell us whether it changes the intent of the resolution, but because they're not here to oppose any of the changes, it still is able to be discussed. Paul Andre?
Yes, as I indicated earlier, because if we change the word inquiry, we're going to make a major change. So I'm speaking against this resolution A.
Okay, Paul Emmanuel?
Paul Emmanuel, Peel chapter. I'm not comfortable with having split the two, but I will get over that. I think that this is an opportunity to really focus on how to change the culture in nursing, because as professionals and how we conduct our exchanges with each other in communication, we so desperately need to have ground rules that would capture everybody's reality. And I see a lot of groups that are not here, like South Asian nurses and Filipinos and Filipinos. I think it's much broader in that way. I don't think we want to cut anybody out, and I trust RNAO to take care of that. Thank you.
Okay, Ifra, was that time's up for this resolution?
30 seconds on discussion on this resolution.
Okay, Dr. Staples. Dr. Staples?
Time's up.
Sorry, I was muted. Can I take 1 second? I agree with Paul Andre that we need action, not inquiry. There's enough literature out there to support moving to action.
Yes.
Okay.
If I may again, once you pass it, if you pass it, we can take that under a strong advisement in operations.
Okay, so now there'll be a poll that comes up to vote on 2A.
Dr. Arlene De La Rocha, can you please confirm the result?
Confirming the results, Ifra.
So 2A passes. Just please be aware, not everybody's on mute. So just if you're going to make comments, make sure, comments to yourself, make sure you check if you're on mute first. That passes with 51% approving. And then, do we have additional time for discussion on this, or do we have to move right to vote?
Morgan, time was up on the full resolution.
Okay, so also there's no time for discussion on 2B, so it will move right to vote.
Dr. De La Rocha, please confirm the results.
Confirming the results, Ifra.
So this one also is carried with 80% in favor, 10% opposed, and 10% abstaining. So we'll go to resolution 3.
Resolution 3, increase support for transition to practice for new nursing graduates, submitted by Catherine Evers and Dr. Veronica Williams on behalf of Nipissing chapter. No known conflict of interest. Therefore, be it resolved that the Registered Nurse Association of Ontario advocate to the Ontario government for increased funding for universal nurse residency program, such as but not limited to the Nursing Graduate Guarantee Program and the Canadian Association of Schools of Nursing Residency Program for registered nurses to support new nursing graduates transition to practice in all practice areas, and therefore be it further resolved that RNAO work collaboratively with other nursing stakeholders to identify strategies for supporting new nurse transition to practice in response to disrupted learning opportunities exacerbated by the COVID-19 pandemic.
Okay. Kathy Moreland.
I move Kathy Moreland from Waterloo chapter. I move this resolution.
And Catherine Ewers.
I so second.
Thank you. And Kathy Moreland, as the mover, you get to speak to it or defer.
I think this is a no-brainer. We know as a retired educator, just watching what's happened over the last 2 years, and knowing that a lot of senior nurses have retired or left the bedside, that it is crucial for organizations and for RNAO to look at how can we support this new workforce.
Thank you. Catherine Ewers.
Yes, thank you. I just wanted to point out that as a nurse educator, we are hearing from students that are, graduating and experiencing a lot of anxiety, more so because of the pandemic, of course, and that the research really does support these kinds of programs, not only for BSCN graduates, but for NP graduates as well. So thank you for considering the motion.
Thank you. Paula Manuel.
Good morning, Paul Emanuel Peel chapter. Our group, when we had discussion about this, we thought there were some opportunities to also leverage code of conduct as per this the College of Nurses of Ontario, because it's incumbent upon nurses to be mentoring other nurses. And so that is a solution towards the problem. Also, when we saw the exacerbated by COVID-19 pandemic, we wondered if there's still disruption coming through, because we know that this has been a long-standing problem for students trying to get a placement. There's also the complexity of practice and geographical differences. So it would also be under advisement that they would need to consider those kind of variables, which I know RNAO will, but always pays off to state what we're thinking. Thank you very much.
Thank you, Paula. Dr. Cooper Brathwaite.
I support this resolution because the students who have gone through the past 2 years and a half have limited hands-on experience of how to care for patients. Being in the lab does not provide the same kinds of relationships, interpersonal interactions, and how you assess a live human being as opposed to a mannequin. So I strongly recommend that we support this resolution.
Thank you, Dr. Cooper-Brathwaite. Miriam? Miriam? Okay, Maria Rugg?
Sorry,
sorry, go ahead, Miriam.
Yeah, I wanted to ask, I don't know if there's room for this in this resolution or anything, but will there be any standardization or curriculum of the new graduate guarantee program? Because I did that program last year and it was pretty messy how it was done. So like there was no like you weren't paired with just one preceptor. You had a different preceptor every day. Often it was with modified nurses just because of needs and availability. And not to say that you shouldn't be working with a modified nurse at all, but it was not somebody who necessarily was trained to be a preceptor or an educator. And often you're paired with other new grads who literally had 5 to like 12 months experience. So there just, I think, might be some room for improvement on these.
Point of order again, Madam Chair.
Yeah.
That's the type of thing we will take under advisement. But for people that write resolutions, I would advise to people to continue to write them general, because the more specific, the more difficult that is for a resolution to pass or to be implemented depending on context, right? So I think the resolution allows, Maria, for all of the aspects you're saying. It allows for that and more, because remember, when you pass resolutions, what we do is we work with the submitters, right, on what was the intent, and then we do an environmental scan, then we consult with others, and then we go with something that responds to the resolution, but it's never exactly what's in the resolution, because that's why you partner with others.
Okay. Thank you. Maria Rugg?
I absolutely support the resolution. The only question, and I think this falls again to what Doris just spoke to and perhaps what Miriam was speaking to, but one thing that's missing here is just the connection with the actual organizations, because I think that's the missing link. The programs are not addressing the actual needs of the organizations and implementing these nursing residency programs.
Okay, thank you. And the last 30 seconds. So we've already heard from Paula on this one. So we'll go to Dr. Paul-Andre Gauthier.
Our association, the Rainbow Nursing Ontario, we are supporting this. And the broad scope for Northern Ontario is important because the needs of Northern Ontario differs from Southern Ontario. Thank you.
Okay, time's up. So the poll will come up now.
Dr. De La Rocha, please confirm the result.
Confirming the results, Ifra.
And that's passed with 95% in favor, 2% opposed, and 2% abstaining.
Madam President?
Yes.
Point of order. I would like to remind the CEO that the consultation reps are representing members from all over the province, and that it's very helpful to have discussion and dialogue. We appreciate that RNAO will take the resolutions forward, but I do believe it's very helpful to have that discussion as in the last resolution. Maria Rugg brought up a very good point about that connection to organizations, not only the educational ones. So
For
I would like to
sure.
put that on the record. Thank you very much.
For
Thank
sure,
you.
we will take all of that under advisement. Thank you.
Okay, and on to resolution 4.
Strategies to enhance clinical practice of nursing students by improving the quality of nursing preceptorship. Submitted by Parveen Govidaraj on behalf of nursing students of Ontario. No known conflict of interest. Therefore, be it resolved that Registered Nurse Association of Ontario to advocate increased funding and awareness of preceptor education programs for nurses so that they can enhance the learning experience of nursing students.
Can I have somebody to move this, please? Karen Hilliard?
Karen Hilliard, Peel Chapter, I so move.
Thank you. And Sarah?
Sarah Miliajo, Lakehead Chapter, I so second.
Okay. And Karen, did you want to speak to this or are you deferring to someone else?
I would defer to someone else. I know it was submitted though by the Nursing Students of Ontario, so I know from the last one we didn't hear from anyone, but maybe there's someone who would like to speak on to address this.
Is there anyone from NSO that'd like to speak to this resolution? No. Okay. Dr. Paul-Andre Gauthier.
My question is about to whom we should advocate. So I understand it is general and open to advocate all over, but the funding, usually it's from the ministry or the government. Nobody has the answer, I suppose.
The submitters do not seem to be here, so I don't think they'll be responding to that. But we'll move to Peroska.
Just a quick note that I know most places do have already a preceptor education program. So my question simply is, what will this do more than what already is out there?
Miriam?
Yeah, I just wonder what preceptorship are they talking about? Are they talking about final clinical placements with one-on-one preceptorship, which is very different with like group clinical placements where you have like the assigned preceptor from the university? So I don't know if there needs to be clarification, but yeah. Because it does greatly differ in everything.
Okay, we'll go to Dr. Cooper Brathwaite next.
I'd just like to add, whether the preceptor is from the university or from the workplace, I think there's a lot of burnout with preceptors, and because of the COVID, people are tired, and some people who used to do it are not willing to do it because their workloads are heavy, they're feeling tired. So I think we need to really encourage and support those preceptors if they're in the clinical placement or whoever is doing the preceptoring, and give some kind of reward or incentive to encourage these people. They need that support. If they're going to support students, they need support from their own institutions as well.
Okay, thank you, Dr. Cooper Brathwaite. I think it's just important. I know the submitters aren't here to speak and respond, but it's really important to think about kind of what's the intent of the resolution, and do you support in principle the intent of the resolution? Maybe it doesn't have all the specific details that you would have liked to see, but in general, is this something that you would like to see supported or not? So we'll go to Margarita Salvatore.
I just feel that basically based on Dr. Cooper Brathwaite, COVID has really changed preceptorship and how the nurses are burnt out. Maybe we need to work on maybe I don't know, some type of relaxation thing for the nurses so that this way they will have their own needs met, and even looking at more funding generally for the hospitals and other places like long-term care to fully support these new nurses.
Thank you. Sarah?
Hi there. I just wanted to speak to the intent really gets to me. My organization in Thunder Bay, we have a preceptor education program. And so it goes through all of the steps on how to first meet your student, develop that relationship right off the hop. Like it's those building blocks that, you know, sometimes we don't get as nurses. Absolutely, we are expected to be teachers and to guide new staff. Sure, we're burnt out, but I think that if we had these preceptor education programs, it'll better enact those nurses to have those skills and all those resiliency toolkit kind of like in their back pocket, so that when they are asked to preceptor, that they can do so and hopefully be better prepared to do so. So I hear that intent and I fully support.
Okay, thank you. Miriam, so Miriam's next, but can you confirm that you're a consultation rep? Miriam Salik?
Hi, yes, Miriam Salik, Peel Chapter. I am a consultation rep.
Okay, go ahead.
I'd just like to add to benefit and kind of help our preceptors and especially hospital nurses. I think it's very important to take in that we need to be able to alleviate their burden a little bit so that the students can have a good quality of preceptorship. And also we need to sort of find a way to pull in newer, more staff, not newer staff, but experienced staff to also sign up to preceptor. So I do also agree with the incentive piece there, and also to alleviate the burden that is currently there.
Okay, thank you. Chantel, very quickly.
Chantel Singh on behalf of the Pediatric Nurses Interest Group. I think the key to this is that we need standardized education or opportunities, because every organization is doing something a little bit different. So it does need to be flexible for each organization, but we need to have standardized funding and resources allocated to each institution to be able to facilitate this. And that's certainly been my challenge that I've experienced.
Thank you, Chantel. Okay, so now the vote will come up on this resolution.
Dr. De La Rocha, please confirm the result.
Confirming the results, IFRA.
Thank you.
So this resolution is carried with 81% approving, 8% opposing, and 11% abstaining. On to resolution number 5.
Resolution 5, strategies to support learning and change within the Registered Nurse Association of Ontario, submitted by Chantal Bernice Ledbetter on behalf of Indigenous Nurses and Allies Interest Group. No known conflict of interest. Therefore, be it resolved that the Registered Nurses Association of Ontario to consider the creation of 3 additional seats on the Board of Directors, a First Nations, a Métis, and the Inuit elders, in order to be leaders of change against organizational and systemic racism.
Can I have someone to move this? Megan?
Megan Kobzik, Indigenous Nurses Allies Interest Consultation Rep. I move this motion.
And someone to second? Miriam, is your hand up to second this? No. Okay, we'll go to Janet Bowes.
Hello, good morning. Janet Bowes, Region 7. I second this motion.
Okay, thank you. And Megan, would you like to speak to this resolution or defer to someone?
I'm going to concede it to Chantel Bryans,
Okay.
the original submitter.
Okay, go ahead, Chantel.
Hello. So with the session yesterday, we did make some amendments. So we've adjusted the therefore be it resolved statement to include a consideration in the change to bylaws to allow one elder/knowledge keeper position to sit on the board. So this is important because the RNAO has affirmed that the nursing profession and abusive treatment of Indigenous peoples by nurses is part of Canadian history and has apologized and committed to rectify this issue. So mode of action would require that the RNAO harmonize organizational policies, practices, and norms with the principles and goals of anti-racism, decolonization, and cultural safety. RNAO must also establish and sustain an Indigenous-led strategic and tactical leadership body that will meet regularly to continue this work. The first step that we are suggesting is the creation of this board of directors seat in order for RNAO to be leaders of change against organizational and systemic racism.
Chantel, are you a consultation representative?
I am not.
Okay, so we'll need a consultation representative to move this proposed amendment by Chantel. Megan, do you, and Jan, we'll go to Sarah.
Sarah Miliajo, Lakehead Chapter, and I so move the amended statement.
Okay, and Mahogany?
Mahogany Hines, Palliative Care Nursing Interest Group, I so second the amended.
Okay, so I see the polls up, but is there any discussion first on the amendment? I see there's 3 people that have your hand up. If your hand's up to discuss the amendment, go ahead. Nope, okay, no hands up, so we'll put the poll up.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Okay, so the amendment was approved, 89% approving. So any discussion on the amended resolution? Rob?
Rob Samuelak, Region 10, Ottawa. I support this resolution. Canada has Aboriginal rights as part of our Constitution in the Canadian Charter of Rights and Freedoms. We've also, as a country, adopted the UN Declaration on Indigenous Rights, and we're pushing forward with reconciliation with the Truth and Reconciliation Tribunal that happened. There was discussion yesterday about other equity-seeking groups. I think that this was the original land, the First Nations, Métis, and Inuit peoples, and they should have a seat at the table guaranteed for how things move forward.
Okay, thank you, Rob. Dr. Paul-André Gauthier?
Thank you. As we did discuss yesterday, there's a possibility, because this resolution is about to consider, not necessarily to have, and also that the recommendation to the board is to look at maybe one of the 12 board representative to be also from the First Nation. And the other option was also the public rep. And one of the other items that was suggested, it's an advisory panel also, because there's not only the First Nation, but the Black nurses, the international nurses, the Islamic, and the LGBT also. Thank you. The 2S LGBT.
Thank you. Megan?
Hi, Megan, again, in the Indigenous Nurses Allies Interest Group. We just kind of wanted to include and acknowledge that the Indigenous knowledge should kind of guide the board and the RNAO, and that the growth of the Indigenous health portfolio within the RNAO brings the need for guidance of an elder on the board.
Okay, thanks, Megan. Paula?
Sorry, my clicker was.
It's okay. Go ahead.
Cooperating. I think based on yesterday's discussion, we were also highlighting that, as Paul Andre mentioned, many different interest groups in terms of fairness and cultural sensitivity. I think the knowledge of the board of directors would be enhanced by having that ability to be sensitive to all of that, and that the Indigenous people are definitely valued, but they don't necessarily have to be at every table. They can be there as advisors. Thank you.
Okay, thank you. I don't see any other hands, so we'll have IFRA put the poll up. And while we do the voting, Doris, do you want to comment on how we operationalize the resolutions once they've passed? Because this is one that would need to be voted on through one member, one vote. So go ahead, Dr. Grinspan.
Thank you very much. Maybe before the vote is done then. Just to remind people, the resolutions are advice to the board. They're not direction. The board needs to discuss every single resolution that is being passed, and hence why we take every single aspect that you have said. This is why we record actually the proceedings, so that we can take under consideration all the matters that you have discussed on every single resolution. This particular resolution, of course, will require tremendous consultation. So for the matters that several of you have brought forward, you may remember that when we moved from MALs to increasing the numbers of interest group reps instead of having the MALs and to have the task forces, etc. At the time was Carol Timmings conducted thorough consultations with all members, and then only after we had the thorough consultations and sessions, I think actually Dr. Cooper Brathwaite was the president, if you remember, Dr. Cooper. Then only after that went to the one member, one vote in a modified version of what needed to look. So this is the intent of what the resolution has. And then everything that you said will be considered if it passes by the board for consideration to further consultations, to then go to the, in this case, a president offered absolutely in this case, then it needs to go to the one member, one vote. So it really is 2 years from now, but the intent is what matters on every single resolution, including on this one. Thank you.
So I call the vote.
Oh, yes, please go ahead and vote.
Can we have it on screen? We lost
sorry,
it.
I thought sorry. I don't know if you need to relaunch that. It's still up on my screen, so I assumed everybody else still had it.
Yeah, just waiting on a couple of more people to complete voting.
I'm a voting rep, Cheryl Forchuk, and I'm not seeing any place to vote.
You should see a pop-up that comes on your screen. If it's not there, check if it's been minimized.
I don't have
Dr. Della Rocha, could you please confirm the result?
Confirming the results, IFRA.
Thank you.
So that passed with 79% approving, 11 opposing, and 10% abstaining. And now we go to resolution number 6.
Commitment to the development of educational resources for those seeking to enter the field of independent practice nursing. Submitted by Proscott Beta, Olivia Brandier, Tracy Hota, and Natalie Sang on behalf of Independent Practice Nurses Interest Group. No known conflict of interest. Therefore, be it resolved that the Registered Nurses Association of Ontario further commit to developing a variety of educational resources for individuals seeking to enter the field of independent practice nursing for the first time. Therefore, be it further resolved that the Registered Nurses Association of Ontario works collaboratively with Independent Practice Interest Group and with other organizations such as Canadian Nurses Association, Canadian Association of Self-Employed Registered Nurses, and Canadian Association of School of Nursing to develop evidence-informed resources in accordance with College of Nurses of Ontario practice guideline.
Okay, Margarita?
I so move on this resolution.
Thank you. And is there someone who'd like to second this resolution? Karen Hilliard?
Karen Hilliard, Pill Chapter, I so second.
Okay, and Margarita, would you like to speak to this resolution or defer to someone?
I'd like to defer to Paraska Bada if she is available to speak on it.
Okay, go ahead, Paraska.
Hi, so I'd like to add a amendment to this resolution from last night's conversation. So it would, we have removed further, so it would read as the Registered Nurse Association of Ontario and strike out further. So just Ontario commit to developing a variety of evidence-informed educational resources for individuals seeking to enter the field of independent practice nursing for the first time. And also, therefore, be it resolved at the very bottom, add to develop evidence-informed educational resources.
Okay,
so I think we need to vote on this one.
Yeah, sorry. So Paraska, are you a consultation? You are a consultation rep.
I am a
see
consultation rep, yes.
So you're able to move that, and we need
like
some.
Okay, so I'd like to move this, the amended version of Resolution 6.
Okay, and Paula.
Paula Manuel, Peel Chapter, I so second.
Okay, any discussion on the amendments? No. Okay, so the poll will come up to vote on the amendment.
Dr. De La Rocha, please confirm the result.
Confirming the results, IFRA.
Thank you.
So the amendment passes 94% approving, 1% opposing, 5% abstaining. Any discussion on the resolution as amended? Okay, if there's no discussion, then we can call the vote.
Can I make a, okay, that's fine.
If you want, yeah, if you want to speak to it, go ahead.
I just wanted to speak to it just very briefly that this is all about to increase knowledge, increase awareness, and increase choices so that people are aware of possibilities through education for those who do wish to practice as independently practicing nurses. That's it.
Okay, thank you, Paraska. I don't see any other hands raised for discussion, so we'll call the vote.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
So this is carried with 91% voting in favor, 8% opposed, and 1% abstaining. And halfway there, on to resolution number 7.
Improving accessibility to childhood vaccine information and standardizing developmentally appropriate resources for children, families, and healthcare providers. Submitted by Hannah Gregor, Kirsten Kinlan, and Chantal Singh on behalf of the Pediatric Nurses Interest Group. No known conflict of interest. Therefore, be it resolved that the Registered Nurse Association of Ontario advocates with Ministry of Health of Ontario, the College of Nurses of Ontario, and Canadian Association of School of Nursing to include the health needs of sexual and gender minorities into entry to practice competencies and and nursing practice standards. Therefore, be it resolved that the Registered Nurses Association of Ontario lobby the government to design, produce, and distribute a provincial standardized, developmentally friendly, multilingual vaccine resource understood at the basic level of literacy that is easily accessible online and in centers where children and families access healthcare.
Okay, I'm just getting a note that this might not be the right resolution that's being read. So can somebody, I see Chantel is here and is one of the submitters. Is it just it's just the piece that's on the screen that was what you submitted?
No, there are still whereas statements, but that is the correct.
Be it resolved.
We have amendments, but we haven't proposed them yet. So
okay. So what you see on the screen is what the resolution is as it was submitted. So we'll go first to Erin.
Hi, Erin Coleman of the Hamilton chapter. I move this amendment.
Okay, thank you. And Chantel?
Chantel Singh on behalf of the Pediatric Nurses Interest Group, and I so second.
Okay, so Erin, do you want to speak to this resolution or defer to someone else?
I'm going to defer to Kirsten Kinlan to speak to the resolution.
Okay, go ahead, Kirsten.
Hi there, good morning. My name is Kirsten Kinlan. I'm the representative for the Pediatric Nurse Interest Group and one of the co-submitters of this. As you read is what we discussed yesterday, and I appreciate everyone for your feedback. I would like to move to discuss amendments. Can I read out our amendments now? Great. Yep. So after discussing with everyone, which we really appreciate all your feedback, therefore be it resolved that the Registered Nurses Association of Ontario lobby governments with S in parentheses. It's not there, but the governments in parentheses to design, produce, and distribute standardized, developmentally and culturally appropriate multilingual vaccine resources for patients, caregivers, and healthcare workers, understood at a basic level of literacy, which are accessible in a centralized manner online and in centers where children and families access healthcare. So I guess I'm looking for someone to
Kirsten, are you a consultation rep?
I am not. Chantel and Erin would be.
Okay, so we will need, I see both Erin and Chantel have their hands up. So
I can move this amendment.
Okay.
And I so second.
Okay, any discussion on the amendment? Brenda's, oh, no, okay. So the poll will come up to vote on the amendment.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, and that is passed with 95% in favor and 5% abstaining. Any discussion on the resolution as amended? Dr. Cooper-Brathwaite?
I support this amended resolution because there's so much false information available to people from different sources. I think we really need this, different languages to meet and culturally appropriate to meet the needs of this diverse population we have in Ontario.
Thank you. Helen Tyndale.
Hi, Helen Tyndale, Wellington chapter, and retired public health nurse who has done a multitude of vaccination clinics for various vaccines. But I also think that since COVID, there's been a number of strategies that have been used with mascots and all kinds of interesting things. So perhaps looking at what happened with COVID and kids' vaccinations might be good to look at as well. I'm just adding that as a comment, and I'm sure that would be looked at as well through probably most likely through public health units. Thanks very much.
Thank you. Dr. Gauthier?
Thank you so much for supporting this resolution, and thanks for our colleagues who did the amendments. We like it.
Okay, thank you. Jenny from Region 3.
Jenny from Niagara region. I just wanted to mention that I actually have experience working in public health in a vaccine program. And something like this does exist in other provinces such as BC, where they have a centralized link with resources in multiple languages. Ontario's health units are currently creating their own fact sheets for these vaccines, which are publicly funded by Ontario. So it makes good logical sense that the province would take this on so that we're not all reinventing the wheel in our individual health units. Thank you.
Okay, thanks, Jenny. Larissa.
Hi, Larissa Gadsby, pediatric nurse practitioner representing Waterloo chapter. I just want to speak in favor of this motion. Congratulations, PedNag, on your work on this. As a pediatric provider, I can also speak to the importance of these resources and how integral they will be for our families due to the rising level of vaccine hesitancy. So bravo, I'm in full support. Well done.
Thank you. Jocelyn?
Yeah, just a quick comment from my experience too in the vaccine program. I think the submitters also, Jocelyn from Ontario Nurses to the Environment Interest Group. One piece I wanted to just mention is the inequities that were spoken about by the submitters yesterday about not only online resources, which everyone can access, but they're difficult to find. And I think that's extremely important for them to be centralized, but also that the tools and addressing the barriers to implementing those resources in practice in rural settings, urban settings, remote communities, and multiple different communities with unique needs. I think that is important. And so when maybe under advisement, when the RNAO is looking at this, consider the need to address those obstacles that may prevent implementation.
Okay, thank you. And Chantal? Oh, time's up. We'll go to the vote now.
Please confirm the result.
Confirming the results, Ifra.
Thank you.
So that is passed with 94% in favor, 1% opposed, and 5% abstaining. And we'll go to resolution number 8.
Expand nurse practitioner scope of practice to include authority to complete forms under the Mental Health Act, submitted by Alana Coleman, Petrina Barbas, Tinga Zhu, Sally Berg, Larissa Gatsby, and Dr. Eric Staples on behalf of the nurse practitioner interest group. No known conflict of interest. Therefore, be it resolved that the RNAO, in collaboration with NPIG, continue to advocate for nurse practitioner scope of practice expansion to include the ability to initiate and complete all forms under the Mental Health Act.
Okay, Shannon.
I would like to move to accept this resolution.
Okay, are you a consultation rep?
Oh, sorry, yes, I'm a consultation
Okay.
rep for the Nurse Practitioner Interest Group.
Okay,
Sorry.
thank you. And Ola?
Yes, I would like to second the motion. And I'm also a consultation rep and the president of FCNIG. Thank you.
Okay, thank you. Shannon, would you like to speak to the resolution?
I would like to give my time to Larissa as one of the authors of the resolution.
Go ahead, Larissa.
I thank you everyone for this opportunity to submit and propose before you this integral resolution. As we know, RNAO continues to advocate for a nurse practitioner scope of practice and removing those barriers, and we have made great strides. This speaks to one of the barriers that is still there. NPs are often the point of care and not having authority to complete some of these forms is a risk to patients and their families. And so we have, as nurse practitioners, the competencies to address the service gaps, to improve care delivery and mental health. And this is a barrier to us to do that. So we are asking for support to continue to advocate to remove those barriers to improve access and equity across all sectors. Thank you so much.
Okay, thank you. Dr. Cooper-Brathwaite?
I support this resolution because it will increase earlier access and care to patients with mental health issues and for their families, will benefit everyone. Thank you.
Okay, thank you. And Dr. Forchuk?
Thank you. Cheryl Forchuk from Brant Haldeman, Norfolk, and a psychiatric mental health nurse for a few decades. And I would speak in favor of this as a good start and hope that when the board reviews this, that they look as well at other nurses' scopes of practice. In my experience as community mental health nurse, at times many hours are wasted trying to find a physician who may have absolutely no experience in mental health. I gave the example yesterday, one time an ophthalmologist living next door to sign a form that a nurse has completed. So I do speak in favor. I will note that all forms include things that can only be signed by police, but again, the board can take that under advisement.
Thank you. Any other discussion on this resolution? No. I don't see any hands. So Ifra, can you put up the poll, please, for the vote?
Dr. De La Rocha, please confirm.
Confirming the results, Ifra.
Thank you.
Okay, and that is passed with 94% in favor, 2% opposed, and 4% abstaining. And now we go to resolution number 9.
Timely access to perinatal mental health services. Submitted by Christina, Canton. No known conflict of interest. Therefore, be it resolved that the Registered Nurses Association of Ontario advocate to municipal, provincial, and federal governments for funding to increase timely access to perinatal mental health services. Therefore, be it further resolved that the Registered Nurses Association of Ontario advocate for increased perinatal mental health training for students and providers in healthcare and social services.
Abir?
Abir Omar, Mississauga chapter, and I move this.
Thank you. And Sarah?
Sarah Miliajo, Lakehead chapter, I so second.
Thank you. And Abir, would you like to speak to this resolution or defer?
I will defer to the submitters if any is available.
Is Christina here? Christina, I see you there. Go ahead.
Yes, thank you so much. So perinatal mental health is a local, regional, provincial, and national issue, and supports are needed now more than ever. The rates of perinatal mental health concerns have doubled during the pandemic from 1 in 5 to 1 in 3. And the perinatal period represents a critical time for providing support and interventions for both childbearing persons as well as their newborns. So there's an urgent need to ensure that families have access to timely, effective, and accessible mental health care. So today I ask for your support to approve this resolution, and together we can advance efforts to implement the 2018 RNAO Best Practice Guideline, Assessment and Interventions for Perinatal Depression. And we can utilize the resources to promote person-centered care and support informed decision-making that's responsive to the context of each unique childbearing family. And I also ask for your support to approve this resolution to amplify the efforts of the Canadian Perinatal Mental Health Collaborative to improve perinatal health care. So at this time, I propose an amendment to change the word training to education. Thank you.
Okay, thank you. Is there a consultation rep who would like to move and second the amendments that were suggested by the submitter? Dr. Cooper-Brathwaite?
I so support this
Okay,
amended.
thank you. And Tahisia?
I so support this as well.
Okay, thank you. Any discussion on the amendment?
Yes, I'd like to commend the persons for this amendment because it's truly important. Having pregnant myself, I've never been questioned about my mental health, and it's truly important. Thank you for this.
Okay. Thank you. Any other discussion on the amendment? Is this discussion on the amendment, Chantal? Or Dr. Cooper-Brathwaite, or discussion on the whole resolution?
Discussion, the whole resolution.
Okay, we just have to vote on the amendment first, and then I'm happy to have you discuss it. Can you put up the poll to vote on the amendment, please, Ifra?
Please confirm the results, Dr. De La Rocha.
Confirming the results, Ifra.
Thank you.
Okay, so the amendment passed with 98% in favor, 2% abstaining, and we'll go to Dr. Cooper-Brathwaite for discussion on the resolution as amended.
I overwhelmingly support this resolution that is amended because perinatal health is critical, not only for mother, babies, but also the entire family. And too many women who have had babies and become depressed hurt their infants unknowingly because of how they're not feeling. So we do need to treat them very special. Thank you.
Okay, thank you. Dr. Gauthier?
Thank you. The Rainbow Nursing Association also is supporting this. And just to be cognizant that there's a lack of healthcare professional providing mental health. This is a big issue right now. And the other thing that my members were indicating that we do not have a standardized assessment tool for appropriate assessment and screening for the woman. Thank you.
Thank you. Dr. Forchuk?
Thank you. And I've also would speak in favor of this motion. I would hope that when the board considers this, postpartum depression is probably the most common issue, but there are other very serious things, in particular postpartum psychosis, that can lead to extremely problematic results that put the infant as well as the family at risk. So to support this, but to look beyond only postpartum depression.
Thank you. Abir?
Hi, I strongly support this resolution because like part of my PhD was about it's a surveillance system called PRAMS, and it's in New York State. Analyzing that risk assessment inventory for prenatal health was very efficient in determining the cases at risk or women at risk for not only postpartum depression, but for other health issues. So this is my proposal that I'm working on to collaborate with the Ministry of Health to develop prenatal assessment, risk assessment tool or prenatal risk assessment inventory or system that can be
thank you.
Thank you.
Time's up. So we will call the vote on this resolution as amended.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, and that is passed with 99% in favor and 1% abstaining. And we'll go to resolution number 10.
Removal of sharps boxes from patient rooms, submitted by Cheryl Forchuk and Matthew McGuigan on behalf of Community Health Nurses Initiative Group, Brent Haldeman for Norfolk Chapter, and Mental Health Nurses Interest Group. No known conflict of interest. Therefore, be it resolved that RNAO promote education and information regarding appropriate organization policies and client-centered assessment to ensure individuals who use substances have access to appropriate harm reduction tools, including sharps boxes, while in healthcare institutions.
Okay, can I have a mover? Dr. Forchuk?
Yes, I so move the acceptance of this resolution.
Thank you. And Shea?
Hi, Shea, Elgin Middlesex Chapter, and I support this amendment.
Thank you. Dr. Forchuk, do you want to speak to the resolution?
Yes, thank you. So we know that harm reduction is a best practice. It's required by the College of Nurses, but we also know it's very unevenly actually applied. In a recent study, we found that with sharps boxes, it ranged from gifting people sharps boxes in hospitals to ensuring that tamper-proof sharp boxes were used to, unfortunately, in some cases, people actually removing sharps boxes if they suspected people were using injectable substances. This puts hospital staff, including nurses, at risk, as well as the people in the room whose boxes have been removed. So we think that harm reduction includes that people really need access, and we've heard this from the people with the lived experience, to sharps boxes. I also move a slight amendment just to the title of the box, and you received that last night if you wanted to go to that slide. And that was, some people were fearful that we might be suggesting to remove them, which is the opposite of what we're doing. So we just wanted to rename that to be 100% clear. It's about accessibility of sharps boxes in patients' rooms. So I will move that amendment. And I think Matthew was going to second it.
Okay, Rob, are you willing to second the amendment of the title of the resolution? No, oh, Matthew wants to?
I move to second the amendment.
Thank you. Any discussion on the amended title of the resolution? Mahogany, was yours discussion on the title?
Yeah, I'm just wondering if there's discussion about potential other amendments at this point.
So we would, if we want to further amend, we would have to have another motion to further amend.
Okay, so can I do that?
After we make this amendment, yes, you can.
Perfect.
Any other discussion on this amendment of the title of the resolution? No. Okay, can we put up the poll to vote on this amendment?
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, and that is passed with 95% approving and 5% opposing. So any discussion on the resolution as amended? Mahogany.
Thank you. Mahogany from Palliative Care Nursing Interest Group. I just want to say with overwhelming joy, I'm happy to support this resolution. I just want to make a comment about the very last line, including sharps box as well in healthcare institutions, just to further extend it to other healthcare settings as well, because not everybody who is receiving harm reduction is in a healthcare institution, as I'm sure they probably don't want to be. So just adding settings as well.
Okay, go ahead, Dr. Forchuk.
That is consistent with the intent in our experience and with the feedback we got from the 114 people with lived experience. They often did have you can get free sharps boxes from pharmacies in the community. Many community agencies give this. The main problem is healthcare, but I'm happy to include the amendment.
So we need somebody to second this amendment. Paul Andre?
Paul Andre from the Rainbow Nursing Group. We second the amendment.
Okay. Is there any discussion on this amendment? Okay, so we'll put up the vote for this amendment.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, so that also passes with 95% approving, 2% opposed, and 3% abstaining. Any discussion on the amended resolution? Dr. Gauthier? No? Okay. Rob?
Hi, Rob, Region 10 Consultative Rep. I would like to suggest maybe putting in an amendment regarding acutely violent or patients who are at acute risk of violence. I have witnessed, well, I work in an emergency room in Ottawa. I've witnessed patients throw chairs at patients. I've heard of doctors getting strangled by their stethoscopes. There is potentially a reason that a nurse would remove a sharps box from a room if there's a risk that the patient will rip it off the wall and throw it at them, or break the sharps box and weaponize the sharps inside the box.
Appreciate your comments and feedback, but our time for discussion on this resolution is ended. So we're not able to make any further amendments on it. So what we will be voting on is the resolution with the 2 amendments that were approved. So what you see on your screen.
Madam President?
Yes.
Paula here. Just to assure Mr. Samachek in Ottawa that what we have discussed still gets minuted and will be under advisement for the board. And it doesn't have to be in the resolution to still be acted on. So just for those that are first timers, as opposed to us long timers. Thank you.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
And that passed with 86% in favor, 7% opposing, and 6% abstaining. So we'll go to resolution 11.
Evaluation of independent practice for support in policy and remuneration from.
Hey, I'm sorry to bother you. Bill Sheet asked me this morning if I needed any help, and I said, no, like I got it all under control. Then I
Sorry,
realized,
somebody should be on mute and they're not.
Can you mute, please? Thanks.
Submitted by Piroska Bata, Olivia Brandia, Tracy Hoda, and Natalie Sang on behalf of Independent Practice Nurses Interest Group. No known conflict of interest. Therefore, be it resolved, RNAO creates a policy to recognize the contribution of registered nurses in independent practice, aligning strategies, initiatives with College of Nurses, Canadian Nurses Association, VRPN, Registered Practical Nurses Association of Ontario, and cancer therapy, enhancing access for Ontarians through the public system, OHIP. In the current climate, this will support registered nurses who provide services outside of mainstream healthcare settings, promotes optimal healthy practices, and advances the role of nursing. It will allow patients to have control over their choices of healthcare practitioners who are probably qualified with the knowledge base and practice standard as per RHPA.
Okay, can we have someone to move and second? Margarita?
I first the motion.
Thanks, Margarita. And Shannon?
I second the motion.
Thank you. Margarita, do you want to speak to it or defer to the submitters?
I would like to defer to the submitters, but I'd also like to make a mention here that if the motion doesn't carry and whatnot, that maybe we go to, instead of going to the board, maybe it should be a one member, one vote type of thing, because this is an important topic, especially considering the privatization. But thank you.
Okay. Does one of the submitters want to speak to this?
Madam President, I think you should explain the issue of what goes to one member, one vote, and what doesn't. Resolutions don't go to one. So just as a general information, I think it's important from a governance perspective, education.
Point of order, Madam President. We need the seconder for the motion before the discussion.
Sorry, Shannon did second it. So we do have a seconder.
Can we move forward just so that we get this done, and then we can discuss the one member vote so we don't take up too much time? So there's an amendment to this before we move forward. So I will read the amended pieces, and this came from yesterday's discussions. So therefore be it resolved that the RNAO creates a policy and increase provincial funding to recognize the contribution of registered nurses in independent practice, aligning strategic initiatives with College of Nurses, Canadian Nurses Association, WeRPN, Registered Practical Nurses Association of Ontario, and Canadian Association of Self-Employed Registered Nurses, CASE RNs in brackets, thereby enhancing access for Ontarians through the public system. In the current climate, this will support registered nurses who provide services outside the mainstream healthcare settings, promotes optimal healthy practices, and advances the role of nursing. It will allow patients to have control over their choices of healthcare practitioners who are qualified, there's misspelled there, with a knowledge base and practice standards as per RHPA. So that's the amended version.
Okay, so you're moving that amendment?
Yes.
Is there someone who would second the amendment? Paula?
I so second.
Okay. Any discussion on the amendment? Shannon, are you discussion on the amendment?
Are we allowed to make further amendments at this stage, or is it we vote on this one and then we do the next one?
It's discussion on this current amendment.
Okay, I wanted to add an amendment.
Sonia, discussion on this amendment?
I just wanted Piroska if she could just explain. I'm a little confused about, I see Registered Practical Nurses Association of Ontario, but then in the second paragraph, it talks about support registered nurses who provide the services. So I'm wondering.
Okay, so it's really simple. We're just aligning the strategic initiatives with other organizations because they already have policies and supportive practices in place.
Right.
RNAO is the only one that does not.
But I'm just wondering, is it supporting registered nurses then?
Yes, it is supporting independently practicing nurses.
Okay, and so the collaboration includes practical nurses.
Yeah, there's strategies. This meaning that you have choices for healthcare practitioners. So for example, a foot care nurse may also be an RPN, not just an RN.
So in other words, in the second part, then the registered RPNs then should be included to be able to bill OHIP.
So, but we are right now only speaking for RNs. They are doing their own lobbying and their own practice guidelines.
Okay.
I am only speaking for RNAO, and the RNA only does so for RNs versus RPNs.
Thank you. I just want a little confusion.
Does that make sense?
Okay, thank you.
Okay. Paula, is it about the amendment? Okay, go ahead.
To the authors, I just wanted to know, when you say increased provincial funding, is that because you're looking outside of OHIP? Because that's something that would not be opened up. Thank you.
I think, well, that's part of it, because last year we looked for outside funding and we were not, it was not a favorable situation. And it was recommended by actually Dr. Greenspan that we should look at the public basket, which now we are considering, just so that we get something going, so that we have policies and we have the funding available to educate, which we already now have, but also to get the funding so that they can actually do the work. And this includes a number of RNs who do this type of work. So you can't just say one section.
Okay, Dr. Greenspan, do you want to just clarify what that piece was about?
Yes, absolutely. First of all, let me tell you, RNAO never has said no to supporting independent practice. In fact, we have done workshops for nurses on food care. What RNAO has not supported is privatization of services. Exactly. And we have said, if I can finish, and we have said that the services need to be covered, exactly. For everybody.
That's why we're doing what we're doing right now. Exactly, because that was the discussion. So we listened, and we responded.
And members are discussing it because maybe it's not as clear as it should.
No, we're clear. We were, but anyway, that was the intent.
Okay, so right now what we need to vote on is the amendment. So Ifra will put up the poll about the amendment.
Dr. De La Rocha, please confirm.
Confirming the results, Ifra.
Thank you.
So the amendment has 79% approving, 8% opposing, and 13% abstaining. So the time's up came up, but I'll give 2 more minutes for discussion on this because there was a lot of back and forth about it. So Dr. Paul-Andre Gauthier.
Thank you. The Rainbow Nursing Group here. I'm just indicating it like I did yesterday. This is a complex situation when we're talking about OHIP. And I said yesterday about the example of the nurse practitioner. They have an OHIP number to prescribe tests. They have an OHIP number to prescribe medication, but they cannot go for the salary directly with OHIP like the physician do. So we have to be cognizant. This is a big one if we're starting with this one. Mm-hmm. May I suggest that we look at maybe doing the nurse practitioner first and see how it goes before we move to everybody else. Thank you.
I believe that would change the intent of this resolution, but noted.
This is not a motion. Okay. It's just information.
I know. Okay. Yeah. Okay. Thank you. Shannon?
I would like to move to amend the resolution. Oh, sorry, Shannon Clausen, and I'm a consultation rep for the Nurse Practitioner Interest Group.
Okay.
And so the amendment I would like to make is to remove OHIP from the resolution. So instead of saying remuneration from the Ministry of Health, in brackets OHIP as the title, just remove OHIP so that it becomes a resolution that's looking for public funding in general. And then in the body of the therefore be it resolved to also remove the brackets that say OHIP and to have it state enhancing access for Ontarians through the public system in general.
Okay, is there somebody who would second that? Or Peroshka, does
I
that
can
change the
second it.
intent? You'll second that?
Well, I don't think it changes the intent. It's still as public funding.
Okay.
So I will second that actually. Yeah.
Okay. So we'll give IFRA just a minute to put up the amendment so that everybody's clear on what it is that they're voting on.
Oh my Lord.
Is that, can you just confirm, Shannon, that that's accurate to what you were moving, the striking out of OHIP in both spaces?
That's correct. Yep.
Okay, so there'll be a poll that comes up to vote on the amendment.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, so this amendment passes with 75% approving, 10% opposing, and 16% abstaining. And we're going to move right to voting on the resolution as amended. So what the poll for right now will be, do you approve of this resolution as it appears on your screen currently?
Sorry, can I just make one quick comment?
So
somebody mentioned yesterday about the spelling. I'm not belaboring it, but remuneration, whatever.
Yeah, we'll make those editorial changes. So we don't need motions to, unless the spelling makes it a different word, but we'll make sure that it's spelled properly when it's published.
Okay.
Thank you, Sonia.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
Thank you.
Okay, so this resolution passes with 67% in favor, 21% opposed, and 12% abstaining. So we'll move to our final resolution, resolution number 12.
Strengthening nurses' human resource in home and community, submitted by Felicia Contopides on behalf of Community Health Nurses Initiative Group. No known conflict of interest. Therefore, be it resolved that the Registered Nurse Association of Ontario lobby the government for designated funds to ensure access to mental health services within 30 days so that children and youth do not suffer long-term consequences related to delayed assessment, diagnosis, and interventions.
Okay, so we need somebody to move and second. Kathy Moreland.
Waterloo chapter moves.
Thank you. And Mahogany.
I'm sorry, just a point of order. Did she just read the proper resolution?
She did. I was just gonna comment on that as well.
Yeah, so I don't think that Marjan read the proper resolution piece.
Okay. So
resolution here.
I was like, the words are different than what's on the screen.
Yeah.
It is different, also different than what's in the script for Marjan to read. So Marjan, we'll just have you read what's on. Ifra, can you confirm what's on the screen is the correct resolution?
Yeah, what's on the screen is correct.
Okay, so Marjan, can you just read what's on the screen then out so everybody's, and then we're gonna delete that moving and we'll restart.
Okay. Resolution 12, strengthening nursing human resource in home and community, submitted by Felicia Canto Perez, behalf of Community Health Nurses Initiative Group. Therefore, be it resolved that Registered Nurses Association of Ontario advocate for fair and appropriate recognition and compensation for nurses working in the community relative to other sectors. For example, comparable compensation, acknowledgement of specialized knowledge and skills, and safe working environment, including access to PPE, vaccination, etc.
Okay, thank you, Margin. Mahogany.
I'm Mahogany Hines, Palliative Care Nursing Interest Group. I so move this resolution and absolutely fully support it.
Thank you. And Margarita?
I so second.
Thank you. Any discussion on the resolution? Or sorry, Mahogany, do you want to speak to it or defer to a submitter from Chinook?
I will defer to the submitters.
Okay. Is Felicia or someone from Chinook here to speak? Oh, I see Felicia's here. Go ahead.
I'm here. Yes, I just wanted to stress that, COVID has emphasized the importance of a healthcare system that includes care delivered in the home by a competent and stable workforce. Home care delivery is a nursing specialty and requires sound clinical knowledge for an extremely wide set of clinical conditions and working environments. And to provide home care, it is necessary to have a workforce who is competent and well connected to the rest of the healthcare system and health information in order to develop appropriate care plans. A shared chart and secure email is one way that this can be accomplished. Home care includes providing complex care in the home, is safe and well accepted, and can be enhanced by virtual care. Excellent care requires continuity and feelings of trust with the care providers. Home health care relies on relationships with the nurse, the PSW, the general practitioner, physicians, and also specialists familiar with the patient. This requires a stable workforce. Current salary scales means that home care is not seen as financially feasible for nurses and results in excessive turnover and fragmented care, increasing expense to the system. In addition, nurses in the community require a vehicle, an added expense to an already reduced salary. RNAO, we hope to support pay equity in order to enable the transformation of healthcare systems, allowing for more care to be provided safely at home. And thank you for this opportunity to discuss these really important matters.
Okay, thank you, Felicia. Margarita?
I totally support this resolution and the fact that these community nurses should be having equal pay to their hospital counterparts. And I feel that the working conditions or the good occupational health and safety is so important, especially considering the pandemic has really shown how minimized home care has been regarded, even with the PPE, where they weren't even given the necessary resources to sustain themselves throughout the pandemic.
Okay, thanks, Margarita. Paula?
Paula Manuel Peel Chapter. Our discussion really covered the who's RNAO going to abdicate to. So just to really bring that into the fore, the key stakeholders are the Ministry of Health and Long-Term Care and Community Care, but also the care providers, the for-profit as well as not-for-profit organizations. They're the ones that set the salaries, but they need to have some kind of accountability for what they're paying out to people, because there is a fairness factor, there is equity here, and what people are being, like incredible schedules that are just obnoxious, like they're supposed to be in two places within 5 minutes and they're like 30 kilometers apart. So I think there's a lot of potential for this resolution. I think that fairness is definitely there, but also to look at knowledge, skill, and judgment, comparative between organizations like hospitals, but also community health centers as well as home care. And to quote Shirley Sharkey, home care is the future.
Thanks.
Where people want to be. Thank you.
Thank you, Paula. Dr. Paul Andre?
Thank you. The Rainbow Nursing are supporting this resolution. From the discussion we had yesterday, I wonder if the mover has the Felicia has some amendment to do for the resolution to make it more friendly.
Yes, there was, can you repeat that? Sorry.
So he was just wondering if you had an amendment that you wanted to make.
There was, we did make a small change from IE to EG. I had resent an amendment after the fact, but it was to remove the word specialized. However, after looking at the comments in the chat and just evaluating the purpose of this resolution is that we do want to acknowledge home care as a specialized skill that is offered in the community. I think I wasn't clear about that yesterday, and upon reflection, we really do want to not acknowledge that home care delivery is a nursing specialty, and did want that to come across in the resolution. If that's okay.
So is the only amendment changing IE to EG?
Yes.
Okay.
It's not an amendment.
That's editorial. So we don't need to make an amendment on that.
Okay.
So just to continue to my point then, after she made the suggestion, one of the things we find is the institutions outside of hospitals are competing quite a bit with the hospitals, and it is really not fair for other institutions and organizations to recruit staff and keep staff when the salary at the hospital is $10 to $15 more for an RN. Thank you.
Okay, thank you. Mahogany?
I just want to echo so Mahogany Palliative Care Nursing Interest Group. I just want to echo the sentiments of Dr. Gauthier as well as Paula. We have a devastating loss to community, and it has direct impacts to all sectors of care, and we feel it across the board. And I just want to say the equity among skilled nurses, as we so often advocate for our patient, we too deserve this equity in the community settings, and it's most evident in our community. So thank you so much for this resolution.
Thank you. So time's up on this one, so we will call the vote.
Dr. De La Rocha, please confirm.
Confirming the results, IFRA.
And that is passed with 97% in favor, 2% opposing, and 2% abstaining. And so that concludes the consultation session. Thank you to all of our submitters for your dedicated work, and thanks Margin, Marianne, the Resolutions Committee, and all of our consultation representatives for attending the AGM and participating on this important and invigorating process. Thank you to everyone for being here and for your active participation today. So at this time, I have the distinct pleasure of asking